In recent years, we have seen ongoing debates regarding the end of life. Physician-assisted suicide, also known as physician-assisted dying, is when a physician provides a terminally ill patient with prescription for a lethal medication they can take on their own to end their life. As of 2021, approximately 20% of the United States population lives in a jurisdiction where this practice is legal. However, patients also make these requests in places where this practice is illegal, which raises some ethical issues for providers. Those opposed to PAS believe a physician providing lethal doses of drugs to allow a patient to end their life would do more harm than good, as the act itself is incompatible with the physician's role as a healer. Those supporting PAD argue that it is a part of the patient's right to autonomy and that physicians' obligations to patients' end-of-life decisions should be honored so a patient may die with dignity, as long as they meet specific criteria, especially informed consent. Unfortunately, dignity in the dying process is not a guarantee. Many terminal illnesses involve pain, suffering, and gradual loss of bodily functions. Naturally, many people do not want to go through this process. However, this is not a choice in many parts of the world, including most of the United States. The right to dignity is a key part of Health and Human Rights' public health ethical framework. For this reason, one could apply this framework when evaluating the ethical dilemma of physician-assisted death. Joan Cheadle was an elderly woman who had lived a happy and healthy life up until she turned 90. Her health began to decline and her memory faded. Joan had a fall which resulted in a hip fracture requiring surgery. Soon after her surgery, she was diagnosed with a rectal prolapse which caused her extreme pain and embarrassment. Throughout this time, her memory worsened and she was eventually diagnosed with dementia. Joan felt that she was a burden to her family and her caretakers. Joan frequently suffered and was miserable. Joan wanted to die with dignity. She eventually asked her daughter to help her die, but ethically and legally her daughter could not help. Joan suffered through severe pain for 2 more years before eventually succumbing to her illness. Joan's story highlights the fact that death can be a slow, painful, and embarrassing process. Viewing her story through the lens of the Health and Human Rights perspective, one can argue that the right to dignity is infringed upon when physician-assisted death is not allowed. Stephanie Packer's story justifies her decisions about her health and life. Stephanie Packer was a 29-year-old devout Catholic wife and mother to 4 children when she found out she had a terminal lung disease. She was advised that she had 3 years left to live and was diagnosed with scleroderma, an autoimmune disease that causes the skin and other organs to harden. Her disease caused constant and sometimes excruciating pain along with fatigue, digestion problems, and humiliating side effects. Despite those circumstances, Stephanie advocates for the use of palliative medicine and hospice care for terminally ill people. Physician-assisted suicide was not something she was considering at the time of this story. Stephanie's decisions are guided by her own beliefs and goals, and when applied to the Health and Human Rights framework, grant her the dignity and freedom to pursue the life she wants. She believes that death has beauty and peace when it is allowed to happen on its own while also acknowledging its uncomfortable challenges. Even as she struggles with her illness, Stephanie wants to focus on today, spending time with her family, and the ability to control her pain out of concern for her children. When her health declines in the future, her plans and goals could change, possibly leading her to one day change her mind about physician-assisted suicide. Applying the Health and Human Rights framework to Stephanie's particular situation advocates for her right to refrain from utilizing physician-assisted suicide. It also serves to refrain from limiting individuals the access to healthcare services like physician-assisted suicide and seeks to empower individuals to claim their rights to health. Physician-assisted suicide or physician-assisted dying is still a controversial topic to this day and is an illegal practice in most of the United States. A variety of arguments exist in support and in opposition to whether physician-assisted death should be legal. The Health and Human Rights framework seeks to support both of the individual narratives of Joan and Stephanie by emphasizing the importance of being free of the denial of rights and having access to the appropriate resources when they are needed. Applying the framework to their individual stories integrates a human rights-based approach to their health, which helps to reduce some of the controversy associated with the decisions they make about physician-assisted suicide or physician-assisted death.